Notice to patients and frequently asked questions about the MetroChicago Health Information Exchange. This notice to patients and frequently asked questions provides information about how your health information may be accessed through the MetroChicago Health Information Exchange, MetroChicago HIE, and your right to opt out so your information will not be available. You may have read about the MetroChicago HIE in your provider's Notice of Privacy Practices required under the federal law known as HIPAA, the Health Insurance Portability and Accountability Act of 1996. What is the MetroChicago HIE? The MetroChicago HIE is a secure electronic way for your doctors, hospitals, and other authorized users to access your medical records from participants in MetroChicago HIE. They may use the information to treat you and for related payment and healthcare operations. How does the MetroChicago HIE benefit me? Secure health information generated by your participating healthcare providers generally will be available through the MetroChicago HIE to other participating healthcare providers and authorized users. This information may include your diagnoses, test results, medications, allergies, and laboratory test results. By participating in the MetroChicago HIE, your healthcare providers can have quick access to your medical records from other participating healthcare providers. This should make it easier for your provider to view your health history and lab tests, even if they were done at different hospitals or clinics. With the MetroChicago HIE, your doctor can spend less time searching for your information, which could be critical in an emergency. Having your information available may also help control healthcare costs by reducing unnecessary tests and treatments. Can I make my information unavailable through the MetroChicago HIE by opting out? Yes. You may opt out in order to decline the further disclosure of your health information by MetroChicago HIE to third parties, except to the extent permitted by law, such as for purposes of public health reporting. Please refer to the MetroChicago HIE website at www.mchc.com/HIE-opt-out for further information about its purposes and audio, visual, and written instructions on how to opt out. Your choice to opt out of the MetroChicago HIE will not affect your ability to receive medical care. However, if you opt out, MetroChicago HIE will block access to all of your health information through its system, even for emergency treatment. Despite opting out, your information may still be disclosed through MetroChicago HIE to meet legal requirements such as public health reporting. Will mental health and developmental disability records be available through MetroChicago HIE? Yes, unless you opt out, your mental health and developmental disability information, such as diagnosis and medication, may be available to participants and authorized users through the MetroChicago HIE. This is permitted under a 2013 change in Illinois law. Prior to this change, your consent was required with limitations that made it difficult to exchange this type of information using an HIE. Despite this change, your written authorization is still required for any release of psychotherapy notes. If you do not wish to have mental health or developmental disability information available through MetroChicago HIE, you should complete an opt-out form and give it to your provider. Will HIV/AIDS, genetic testing, or sexual assault information be shared? Some types of sensitive medical information may require your consent to be shared under Illinois law, so it may not be available through the MetroChicago HIE unless you consent. Examples would include information about HIV/AIDS testing and genetic testing. In addition, if you receive services from a rape crisis organization, those records would not be shared without your consent. Will alcohol or substance abuse treatment health records be handled differently? Your records should not be available through the MetroChicago HIE if they were generated by a federally supported alcohol or substance abuse treatment facility that is covered by a federal regulation known as 42 CFR Part 2. You may ask your provider if it is subject to this regulation. Information about alcohol or substance abuse from other sources may be shared through the MetroChicago HIE if you do not opt out. Can I prevent specific health information from being accessed through MetroChicago HIE? No, at this time, MetroChicago HIE cannot prevent specific information in your record from being shared. Except for certain health information that your provider must filter out if you do not consent, your information will be available to participants in MetroChicago and authorized users unless you opt out. How can I opt out of MetroChicago HIE? You can opt out by completing an opt-out form and giving it to the office of any healthcare provider that is participating in the MetroChicago HIE. Each participating provider will have the opt-out form. What will happen if I opt out? Access to information about you will be blocked approximately 24 hours after MetroChicago HIE receives the opt-out notice and will apply to information about you from all participating healthcare providers and authorized users. Can I reverse my opt-out? If you later reverse your opt-out, information from the period during which you had opted out may be available through the MetroChicago HIE. You can reverse your opt-out by completing the reverse opt-out form available from any participating provider and giving it to the provider. Please note, it is always good to make sure your healthcare provider knows about all of your current conditions and medications, whether or not you opt out. You should not expect that your provider will have all of your current information through the MetroChicago HIE. Opting out of MetroChicago HIE does not mean that you have opted out from all other HIEs. Ask your provider if it participates in other HIEs and if you need to complete additional opt-out forms. Is the MetroChicago HIE secure? Who can see my information? MetroChicago HIE is protected by privacy and security measures to help assure that your health information is private. Your information is only available through MetroChicago HIE to participants and authorized users who are subject to state and federal privacy laws, including HIPAA. MetroChicago HIE uses encryption and can track user access to help protect against unauthorized uses and disclosures. However, with any electronic system, there could be a breach of security and an unauthorized person might obtain and use your information for identity theft or other illegal activities. This could also occur with paper health records, but a breach of electronic systems may affect more records than might occur with paper records. How is health information shared before electronic exchange? In some cases, information was not shared. If it was, doctors would have to call, mail, or fax it to another provider, or you, the patient, would have to track your records down and deliver them to your provider. This could take a long time and delay your care. The MetroChicago HIE should be a much faster way to exchange information. What if I have more questions? For more information about MetroChicago HIE or your privacy rights, please refer to your healthcare provider's HIPAA Notice of Privacy Practices or speak to the HIPAA Privacy Officer for your healthcare provider. For additional information on MetroChicago Health Information Exchange, please refer to the MetroChicago HIE website at www.mchc.com/HIE for further information about its purposes and audio, visual, and written instructions on how to opt out.